so we're doing a prolotherapy solution to help with patients' back pain today. Prolotherapy is called proliferative therapy. Usually we're using something like sodium urate, phenol, glycerin, dextrose, something to create some inflammation. When we're talking about wound healing inflammation. So you initially think about the first couple days when you get a cut, you have the first 7-10 days, you have this goo that forms. That's inflammatory phase, right? Then you have a stage that goes through the matrixy phase where it builds up. It goes from like 7 days all the way up to like 5 to 6 weeks, and then you have the remodeling phase, which comes back to normal tissue. Now, very typically ligaments and tendons, end of tendons, which are muscle-bone connections, and ligaments are bone-to-bone connections, don't have a lot of blood supply. So what ends up happening is the body does not heal it properly, okay? So when you go to the gym, how you're actually exercising and building muscles, you're tearing the muscle, tearing muscle, but because muscles have a lot of blood supply, it heals properly. As far as the ligaments, they don't. And for that reason, we're trying to tighten all those areas. And just like when you're welding, you don't just look for the big spots here and there and then just weld here, weld there. You have to weld the entire area. So whenever you look at a ligament and it overstretches or some sort of injury happens to it, all along you want to make sure that it's properly addressed. So when we do it, we're actually injecting all along the areas, and we're doing a Hackett-Hemmel approach. And so we'll get to it with this patient, and hopefully we'll see how he does, improves, and then can take a couple sessions, but hopefully we'll get a good result out of it.